So let's talk a little bit about occupancy numbers here.
Sure. Primary seniors housing, 80.7%. That's right, in 2020.
And assisted living down to 77.3. What does this mean to senior living, do you think? That's really my big question, is what do these numbers mean?
Yeah. You know, I think there's the question here, which is, glass half full, glass half empty. And, what I mean by that is if you look at the trend overall, I mean, let's just say that occupancy is at a record low. And, it is certainly very, very challenging to be out there. That said, if you look at the rate of change quarter to quarter, the rate of change from third quarter to fourth quarter was slower than it was from second quarter to third quarter and first quarter to second quarter. That said, it's still monstrous in terms of the decrease in occupancy relative to any other time period, right? So just looking back historically, the only other time we saw a change in occupancy greater than 1% since we started tracking data in 2005, I think I was looking at the data set here in seniors housing. I think it was in 2009 or so, right? So it's been a really long time. Normally the types of change you see are, less than, they're 0.2, 0.1%. And so this is a massive, massive change. It is still a negative occupancy component. And so I think one of the other stats that we had looked at was to see that the number of occupied units right now in the kind of our primary markets, 31 markets, it's the same number of occupied units that were there in third quarter 2017. Right?
Really, that's a really interesting number. That's an interesting number. Are we going to see massive failures in senior living, do you think? Any thoughts on this? What kind of shuffling we're going to see?
Yeah, I mean, I think there are, unfortunately, with every significant change, there uncovers or challenges. There are opportunities for people. And so I think what that means is, almost by definition, right? I mean, there will be some opportunity. Challenges are opportunities for others. And so, I think that is part of unfortunately, of the economic cycle. And so, there will have to be some changes as people figure out how to work with one another. And in some instances, folks may say, it's time for us to part ways and let's go ahead and figure out a different business model. I do think, however, though, that the long-term fundamentals, and you hear this over and over again, right? The long-term fundamentals are still strong. They're still there. And even as you talk to a lot of, particularly on the equity side, their long-term plans in many instances are very similar. It's just in the short term, how do you make it through this pandemic to get to the other side? And so there may be some changing of hands as we get through to the other side and look at then essentially the recovery period. And of course, one of the huge concerns right now is the direction that the pandemic is taking as we roll out the vaccine. And to some extent, even some of the question marks with the variants of the virus, the mutations of the virus that have started to spread as well.
From my perspective, first off, it seems like the capital providers are being amazingly graciously patient with operators who are doing a good job. And but I also think that it will uncover operators that are maybe not doing as good a job as they could or should do, and that we'll see some at least shuffling of individual properties. And it's locally painful for the operators and employees, but probably it's actually better for the industry is what I'm thinking. It seems hard that we're going to see a lot of buildings closed because the fundamentals, as you say, are still there.
Absolutely. And I think, you've hit on a really good point, which is I think the working relationships with capital providers and the operators, really is at the point where they are trying to figure out how to make things work, because it's in everyone's best interest to make it work and make it through this time period.
As you talk to, I know you get to talk to a lot of operators. Do people feel like we're going to be back to some semblance of normal in 6 months, 12 months, 24 months? Any thoughts on what people would think? I know it's sort of crystal ball gazing, which is always hard and dangerous to do, but any thoughts?
I will, I think that's really tough to say. I wish I knew, and I feel like to some extent that is the, maybe the multi-billion-dollar question or the million-dollar question.
Yep.
And that really is, it's figuring out when do we hit the true trough from an occupancy perspective? What does it look like on the backside in terms of leasing back up? How do we ensure that the value proposition for senior living is adequately communicated to potential residents and their adult children in a way that gets folks essentially moving back in to rebuild occupancy.
I hope this doesn't sound like too weird a question, but because I want to be mindful of, the loss of life and the sickness and the economic damage and the emotional damage. But do you see some lessons that are coming out of this that is actually going to make the industry better, stronger?
I do. I mean, again, and as you have noted, the biggest impact here, of course, has been loss of life and the toll that's taken on the families, as well as the caregivers themselves. But in terms of lessons learned, I mean, one of the things that the pandemic has done is really accelerated many of the trends that I think have been occurring over time. First and foremost, one of the pieces there is the kind of the importance of health care to the senior living space. I think we may have spoken about this several years ago. Is it hospitality or is it healthcare? And I think it really has shown the importance of having. It's not either or. It's both, and it's potentially having hospitality front and center, but having the healthcare as a invisible safety net that is there and solid and able to help residents live their best lives, and to have access to that healthcare in a way that allows them to do so, potentially within the community without having to go to a hospital, which right now is in many instances a dangerous place to go visit, or might be challenging to, quite frankly, to have occupancy in a hospital to be treated.
Yeah, well, I certainly know that I'd have to be really, really sick before I'd want to go to a hospital right now, even if there are beds available. And at least in my location, it's tight, but we do have some capacity here. But I'd be really, really nervous about that. So you're going to hate this, but I'm going to try it anyway. Is this going to be the worst of it? Will the next quarter's numbers start to turn around, you think? Speculation.
Yeah, no, I'm excited to see obviously the vaccine rollout. I think that's fantastic. And, I think there may be this opportunity really where being within senior living communities might be one of the safest places to be because it has access to the vaccine. And so that's fantastic. And, quite frankly, I mean, these are professionals that are trained in infection control that can provide the care and service that are necessary for frail elders, and that are working through protocols to allow folks to go ahead and have those social determinants of health that would lead to a higher quality of life over time. And so I think much of that is there. Whether or not we've hit the trough, right? So again, the rate of decrease has declined. However, it's still a huge rate of occupancy decrease, right? So at 1.4% or so, quarter over quarter, that's a huge number. And so I think it would be surprising to see that go to zero and then start going positive in a quarter. Question is, will it be by the end of 21? I don't want to do too much crystal ball gazing over here, but I certainly think, again, with the vaccine coming out, the hope would be that we move towards some new sense of normalcy fairly, certainly by the end of by 21 or early 22.
Yeah, I'm going to give my own crystal ball. You didn't ask for it, but I actually think at least this next quarter we'll go back to break even. I think that there's a fair amount of pent up demand of people who said, particularly, with the holidays, I'm not moving in until after the first of the year because I don't want to do the quarantine thing. Now I'm going to go because I need to go. I think that the getting back up to whatever the new normal is going to take a year or more, probably more than a year. But I actually think next quarter, the first quarter of 2021 will actually at least see us get back to not dropping any further. So we'll go back and look at this in 3 months and see if that's true. So I'm going to give you one opportunity if you want to talk about it. You want to talk at all, pitch the spring conference and what that's going to look like? You have any news on that yet?
Yeah, so from a spring perspective, we're foregoing, what I would say is a traditional virtual conference, and we're actually conducting a series of leadership huddles. And so those leadership huddles, they are free for anyone to attend. So we certainly welcome folks to go ahead and participate. You'll see some material on our site, and we'll be putting additional information out as to the content and dates associated with the leadership huddles. But it'll be content that's very similar to what we've had in the past at the events. But I think in a time here where it's challenging to, quite frankly, make the time to attend a conference, we thought it was important to get the information out there in a manner that could be widely accessible to as many people as possible to ensure that we can try to get through this challenging time together.
Perfect. Great. Brian, thanks for the update. Thanks for your thoughts on this. I do see things much better in 2021 and looking forward to a in-person fall event. So, and I know you've actually got to get off to a huddle here in about 5 minutes. So,
Steve, thank you very much for having me. I really appreciate your time and enjoy chatting with you as always.
Yep. Thanks.